October is Breast Cancer Awareness Month, and though it is a disease we hear a lot about these days, there's still a lot of questions and some confusion about the signs, the symptoms, when we should be getting screening. So to help inform all of us, we have Dr. Marcela Mazo here with us today for our Q&A, breast oncologist at UT Health San Antonio MD Anderson Cancer Center. Dr. Mazo, thanks for your time. I really appreciate you being here. Let's first start talking about when women need to get that first mammogram. Over the years, the guidelines have changed. So what is it right now?
Thank you so much for the invitation. So we classically tell our patients that the screening mammography should start by the age of 40. However, it's very important to remind each patient to talk to their doctor. Sometimes the screening guidelines can be different for each person depending on their family history or their personal history. So as a rule, I tell my patients 40, but there might be some conditions that will, put you in an increased risk category in which you will have to do certain things for your screening different than the general population.
And with COVID-19, a lot of people put back or push back just any type of checkup. How much has the pandemic impacted, breast cancer checkups, and how much are y'all trying to do to catch up to that?
So fortunately, the COVID-19 pandemic actually delayed a lot of our patients coming to get their screening mammogram. Thankfully, with the vaccine in place, we have been able to get more of those patients coming into the clinic to get checked. So slowly but surely, we're getting back those patients again to our clinics to get checked.
You mentioned family history, always important when talking about really any kind of cancer. I have heard examples of women who have a family history of breast cancer being screened to see if they have that BRCA gene. Hope I'm saying that correctly. If somebody does have a family history, should that be a step that they take? Should they be screened for that?
So I'm glad that you mentioned that. So the BRCA or BRCA gene is basically a change in your DNA that will put you at an increased risk of having breast cancer or other types of cancer. So if there's a first degree relative, your mom, your sister, that has been diagnosed with that mutation, it's important that you talk to your doctor about taking the right steps to get yourself tested. I should mention also that in certain type of breast cancers, when we get the patient to clinic, we're going to have to screen them for that mutations, especially if they have, for example, cancer that is spread all over, a specific type of breast cancer called triple negative breast cancer, also when the patients present to clinic and they're younger than age 50. So there's some criteria, and the best answer is always talk to your doctor.
And with just people who've had it in their bloodline, is there a certain ethnicity that it sometimes lacks or struggles to get checked up as often as they should?
That's a very good question. And we see it all the time. Unfortunately, in San Antonio, with us being a majority Hispanic population, we see a lot of patients being apprehensive, being hesitant. So I will say that sometimes we see that our Hispanic patients, they tend to be more apprehensive. There's more fear. So sometimes that's a big barrier for us to get those patients to talk to us and to get them screened.
Yeah, that's a big part of your work, not only as an oncologist treating cancer patients, but helping to educate when it comes to cancer, educate the Hispanic community in particular, kind of breaking down some of that fear that you said tends to exist sometimes within certain communities. Is there a certain cancer myth, breast cancer myth, that you often find you're up against or having to dispel?
My gosh, unfortunately, we see a lot of myths. For example, patients often ask me, wearing a certain type of bra, wearing an underwire, is it going to increase my risk of breast cancer? And the answer to that question is no, it's a myth. There's no type of bra that is going to increase your risk of breast cancer. I hear a lot about the deodorant, also certain types of deodorants causing breast cancer. That is also a myth. And I will also have this opportunity to say that, a lot of times patients feel that when they have a lump, that it's something that it can be ignored because it's most likely nothing, or it's just related with your period, which I will say it's, in a way, a myth, because, when you feel something abnormal, the best thing to do is to go and get yourself checked.
You know, you're talking about the certain kinds of things patients ask you about that they do themselves every day. Could that influence their risk? We know we are told to do self-exams. How often should women be doing that, and what exactly should we be looking for?
So actually, I want to be very clear that the self-exams, they never replace screening mammography for breast cancer. I always tell my patients, be aware of your anatomy, know how you look, so you're going to be more sensitive to pick up on little changes. So breast exam is not necessarily the best tool. And I think we should not rely just on that to say, oh my gosh, I'm fine, I don't have any problems. It's good to be aware, but I want to be very clear that nothing replaces having that screening mammography done.
And this is kind of a two-part question, and jumping back to Hispanics not going to the doctor as much as they probably should. As a Hispanic man myself, I know we carry that kind of machismo mentality and put off checkups. That being said, men can also get breast cancer, but why have women also put off these checkups?
You know, that's a very good question. And I feel like most of our patients sometimes delay their own care because they're taking care of children, they're taking care of family, they're working, and they put themselves as a last priority. So I think that's a big barrier for us. You know, I think in women necessarily, I mean, compared to men, there's not so much like a cultural issue. It's just that I think mostly the Hispanic women, we tend to put ourselves, in last, and we prioritize other things over our own health.
Yeah, we're all busy. We can all find reasons to make excuses, put things off. COVID has been a big one, but certainly not a reason to miss any kind of screening or conversation with your doctor. Absolutely. Dr. Marcela Mazo, thanks for having a conversation with us. We certainly appreciate it.
Thank you for having me.
Absolutely.